So let's talk about some regions of the vertebral column. So your vertebral column has 5 different regions, and we start with cervical, which is going to be up towards the top. Okay, you should remember cervical as one of your body regions, and it has to do with the neck. And there are 7 cervical vertebrae. So we can actually start at our first vertebrae and count down. So the way we reference vertebrae is cervical would be C, and then we number them. So this would be C1, C2, C3, C4, C5, C6, and C7. C7 has this really long spinous process. You can see this from the side here. And you can feel this on the back of your neck. If you bend your head forward and you feel this bone sticking out in the back, you know that that is C7 spinous process. Okay? The next region is going to be thoracic. And thoracic vertebrae all have ribs attached to them because they're in the thorax. So we have 12 thoracic vertebrae, so we can count thoracic vertebrae as well. They start with T because of thoracic, so T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and T12. Okay, and that should be the last one with a rib attached to it. Our last well, not our last segment, but our next segment of vertebral column is lumbar. And lumbar is going to be in the small of your back. And we have 5 lumbar vertebrae. So we can count them. They start with L because of lumbar. So L1, L2, L3, L4, L5. And that gets us all the way down to the bottom. Now, at the end of the vertebral column, you're going to see this triangular shaped bone. And this is the sacrum. And the sacrum is formed from 5 fused vertebrae. So it basically is one piece at this point. And then at the very bottom, you have the remnant of your tail, and this is the coccyx. So little tiny coccyx at the inferior aspect of the sacrum, and it consists of 3 to 5 tiny little fused vertebrae. One last thing about the vertebral column is that you can see as we stack up the vertebrae, we have these curves in our spine. So you have a curvature here in the cervical area, you have an outward curvature in the thoracic area, you have an inward curvature in the lumbar area, and then you have another outward curvature in the sacral area. So the curves kind of alternate. Primary curvatures would be convex curvatures posteriorly, so thoracic curvature and our sacral curvature are considered primary curves because that's what you're born with. So when you're a baby and you kind of have that little C shape as a baby, once babies start to lay on their stomach, their cervical spine curve reverses and it becomes concave posteriorly. And then once the kids start getting up and walking, they reverse their lumbar curve and they end up having a concave lumbar curve here, which is called a lordosis. Okay, now you can have excessive lordosis, and you probably know people who have excessive lumbar curvature here and excessive lordosis. Patients who have excessively rounded shoulders or rounded area through the thoracic spine is called kyphosis. So those are terms that you're going to see as well.